All right, hi everybody. I'm going to talk to you today about a little bit of an injury that I have, and I know that there's some other people who have experienced the same sort of thing. And so I'm hoping just to give you a little bit of enlightenment with respect to the injury, and then help you to understand it a little bit as well. So a week ago, I was at a basketball practice with one of my sons, and I took a little bit of a jump shot, and I experienced a loud pop in my calf, and for a minute I was very concerned because it was quite painful, and I thought that I had likely torn the Achilles, but then I quickly realized that wasn't the case because I was still able to generate a little bit of power from my lower leg. So I want to show this to you, okay? Because if you look at it, it might appear that the injury itself is in the ankle. So this, again, remember, this is 1 week later. So this is the inside of the ankle, and then we have the outside of the ankle, right? And it looks pretty serious, okay? And in a sense, it was, because it's been very difficult to work for the last week. So what happened is that there was no warm up, and I didn't prepare my body for what I was about to ask it to do. And as I took off and jumped a little bit, that popping sensation came, and there was a tear in the calf itself. The calf is made up of two muscles. So we have a bigger muscle, and it's called the gastrocnemius, which aids in a little bit of knee bending. So a little bit of knee flexion this way, and then also plantar flexion that way, okay? The soleus muscle, which is a smaller muscle, which sits underneath it, does not aid in knee flexion, so the bending of the knee, it just helps in the plantar flexion of the ankle itself. So the tear was in the calf, and so if you see somebody who has that swelling and bruising that appears to be down around the ankle, you would assume that the injury itself was in the ankle, which it is not. Over time, as the body creates that inflammatory response, and there's a little bit of bleeding that comes from the tear, gravity will pull that fluid down, and it likely will settle in your ankle. The same could happen if you tore a hamstring as well, right? You might end up with some bruising over the muscle belly itself, but a lot of times people will experience that pooling of particulate and blood lower down in the leg, around the knee, and even in the ankle as well. So I found it very difficult to walk this week. There's different grades of muscle tears. Most people will grade a grade 1 tear if we have 10 to about 25% of the muscles that are torn, and then from 25 or 10%, depending on which resource you're looking at, up to about 90%, we'll call that a grade 2 tear. All right, grade 2 tears are likely going to be the ones that are more painful, although grade 1 can be painful. Typically will be described more as stiffness after a workout and discomfort, whereas grade 2, you're gonna start to hear people use the word pain quite a bit more as well. And then grade 3 is a complete rupture, and is on the worst end of the spectrum. So I have been able to walk, but it's been challenging and difficult, and my strides have been very short, and I haven't been able to really use the calf much, or it hasn't been able to provide much power. And so a common mistake with this injury in the calf, and again, I'll show you the difference in the calf sizes. It has gone down a little bit, but you can tell that when I hold those two side by side, that there is definitely some swelling in that left calf. And I apologize if the screen made that upside down or wrong side out, but I'm a little bit new at this. So one of the mistakes that is made most commonly is that people will want to stretch that tear, right? They want to stretch out that injury. And we really don't want to be doing that for 10 to 14 days typically, because when there's a tear, we need to give those myofibrils, or those muscle fibers, a chance to kind of reconnect and heal a little bit. So we haven't done any tissue work on my calf as of yet. We have done some laser therapy, which has been very helpful to naturally kind of reduce a little bit of inflammation and speed up the healing process of the muscle itself. Another thing that we don't like to do much anymore is to ice it, right? We want good blood flow coming into the area. The old acronym RICE, rest, ice, compression, elevation. We're not doing that a ton anymore, and there will still be some that will disagree on this, but we actually after the first 24 hours will exclusively use heat, or as our clinic prefers to do, we'll use laser therapy. Because we can speed up the recovery of the injury significantly, sometimes as much as 40%. I'm a week into this. I can now create a little bit of power and put just a little bit of weight back on the ball of my foot. So I'm not in as much pain today as I have been over the last week. But still, we won't be doing any soft tissue release, massage, or stretching for another week or so. And then at that point, if we're at the right place and it's appropriate, then we'll start to do some specific sort of rehab exercises so that we can ask the muscle to contract, and as the body is healing, we can get those fibers to lay down in the appropriate direction so that we don't end up with a bunch of kind of mesh network around that injury, leaving us vulnerable to further injury and vulnerable to achy pain as well. So I look forward to that. If you've experienced a muscle tear, a hamstring tear, or a calf tear, or a tear anywhere else, it's very wise to have somebody look at that and evaluate it for you to get a grade on it, whether it's a grade 1, a grade 2, or a grade 3. A grade 1 can come around very quickly. A grade 2 is going to take a little bit more time. And a grade 3 can be pretty serious and sometimes even require a surgical repair. If you have any questions about it, we wanted you just to be able to see what one looked like. A lot of times that swelling or the discoloration in the lower extremity can be quite alarming. That's okay. The body's lymphatic system will take care of that over time. And we don't want to stunt or stop the inflammatory response at this time. We want to aid the body in healing. So we're actually applying heat and light at this time. And we are not stretching and we are not icing this injury, as we know that would be something that would prolong the recovery time. If you have any questions about these sort of injuries, give us a call. Here at Arvada Sport and Spine Group, we're a team of chiropractors and physical therapists. We'd love to give you some advice or point you in the right direction and get you back in your game as soon as possible. Thank you. Bye-bye.